I'm going to hand over to Lydia now. We're very excited to be doing our part 2 of the EHCP back to school. So Lydia, I'll let you introduce yourself and then we can get started.
Lovely, thanks Jade. It's really lovely to be back, and this is going to be covering topics to do with EHCPs, back to school, and some of the queries that we get asked sometimes, but it's by no means a complete list. And if you have any other questions, I will do my best to answer them as we go through.
Great stuff. So a very big question right now, Lydia, relating to COVID. So are there any COVID-19 restrictions on the EHCP provisions in schools?
So there's not, and there hasn't been for quite some time now. As it stands, EHCP provisions need to be fully implemented, and pupils need to be in school full time as well. If you have concerns that this isn't happening, and that could be for a number of reasons why it's not happening, the first step is to speak with the school that's named in the EHCP, and then depending on what the school says, what their concerns are, what the reasons are for lack of provision, lack of attendance, then raise it with your local authority. They have the ultimate responsibility to ensure the EHCP provision is in place from the get-go. There are then formal options that you can use to raise that with the local authority if they're not doing this. Their examples are complaints, judicial review. None of these are quick fixes, however, so the first step would always be to try and speak with school and local authority to see what's going on.
Thank you. Okay. Oh, a few technical difficulties. There we go. So what happens when my child is due to transition to their next stage of education next September? So for instance, if they're going from primary to secondary.
So what you need to be doing is planning ahead, really, with a year to go. It's not that long, actually, when you get stuck into EHCP transitions. It really isn't that long at all. Your child's school, so the one or young person's school that's named in EHCP, they'll need to arrange for a date for the transition review of the plan. Ideally, this needs to happen before the end of this coming, well, this now autumn term. This is to allow time for the local authority to then issue a final amended EHCP, which will then name the next stage placement, so secondary, junior placement, whatever it may be. They need to do this by the 15th of February at the latest. So you really want kind of everything sorted before Christmas, certainly in terms of having had the review. So what parents should be doing during this time, if you haven't already done so, is consider what you want your preference to be for the next placement. So do you have any in mind? Do you need to go and visit? Do you need to consult? And put those to the local authority in good time with any relevant information, and that's then on the local authority to bring it all together, issue that decision for parents by that 15th of February deadline. There is a difference, however, if you are going from secondary into post-16 placement. The only difference is the deadline for the local authority to issue that amended plan, naming next placement, is by the 31st of March. So you have a little bit more time, but still it's worth being proactive about it rather than leaving it to the last minute, because if you get to that decision and you don't agree with the school named, parents or young person has a right to appeal that decision. That process in itself can take 3-4 months, potentially longer. So you really want to get your choices in as soon as possible and push for that decision as soon as possible by the deadline as well.
Okay, thank you. Now on to our next one. So what type of school can be named in an EHCP?
There's quite a few, and this sometimes can be a bit of a minefield to work out what type of school a particular school is, if that makes any difference in terms of it being named in an EHCP or not. There are different types of schools that are maintained. You can have maintained or non-maintained schools. So you might have maintained nursery schools, primary schools, academies, free schools. So they're all maintained by the local authority. You may have non-maintained special schools, for example. They are different to an independent school. Sometimes there's a bit of confusion around non-maintained and independent. They are two different types of school. You may also have further education, sixth form colleges, and then independent schools in particular are then divided into two different categories. And there are independent schools, which are probably the majority of them, which are approved by the Secretary of State. They're called Section 41 schools because it refers to Section 41 of the Children and Families Act 2014. And there's this approved list. You can easily search for it online and you'll find this complete list of approved schools. There are then independent schools that are not approved by the Secretary of State. Any of these can be named in an EHCP. The difference is if it is an independent school that's not approved, so it's a non-41 school, the local authority is required to consider parents' request to consult with that school. Even if that school is actually named in the plan, however, they don't have to admit the child or young person. That is the difference between all the other types of schools where if they are named, they have to admit the child or young person. It's those ones where they're not approved, you've got to be a little bit careful about, just to make sure that school's completely on board for your child to go there and they've offered a place and they're happy and they're willing to take them and say that's absolutely fine. Otherwise, the local authority or a tribunal for that matter can't enforce them to take the child if named. There are different types of schools. We do have more on this actually on our website as well. We've got lists of different types of schools and a bit more information on there as well. It's also worth remembering as well that local authorities can just name a type of school in an EHCP. They are legally allowed to do that. Ideally, you want to see a name of a specific school and a type, but in some cases that's just not possible. But in most cases, if it is just a type name, parents are going to say, well, we want to know which school our child's going to go to. And so usually that will involve an appeal for a specific school, particularly if there's one that parents have in mind already.
Okay, thank you. Guys, I just want to say if anybody has any questions at all, please pop them into the chat box. You know, if Lydia's touching base on anything you want, you know, sort of explained further. So Lydia, the next question we have is what happens if my child attends a mainstream school with the resource provision? What needs to be detailed in their EHCP?
Again, this is one where there can be a bit of uncertainty about what should be included in the EHCP and in particular which sections of the plan. Because normally placement you would see in section I, that is where placement and the type of placement would be detailed. If there is a resource provision as part of that as well, but ideally that should be in section F because that is seen as part of the provision and the support the child is going to get whilst at the named school. The resource is not a school kind of entity in its own right, it's part of a school. But it is something where you do see it where it's also in section I as well. And I've seen it where you have it listed under section I. It's not uncommon for this to happen. It's just something where if you can kind of request this in F, that would be the kind of ideal way to do it. But ultimately, it doesn't make too much difference. The main point you want to be clear is the school, but also if there is going to be part-time, say in a resource, part-time in a mainstream, you just want that clear in there as well as the provision as part of that placement, that is what's going to happen as well.
Thank you. So Lydia, what happens if there are two schools named in the EHCP, my preference and that named by the local authority?
So this can and does happen for a number of reasons. Sometimes it happens when a local authority agrees to name parents' preferred school. Usually, if parents also contribute towards that, so there might be towards transport costs, part funding provision in the plan, something like that. Often this happens when you've got a local authority school put forward and parent school is also put forward, but it's further away, it's more expensive. So sometimes to reach agreement or to avoid an appeal, agreement can be reached where you reach this kind of compromise. Usually, if you do have something like this, there would be wording in section I that would clarify that. For example, it's parental preference school is named, local authority still maintains that the other school can meet needs, but they have named parent school on the basis that parents will contribute to transport, something like that, whatever it is. It's important that even though that at the time is, if that's what parents want to do to get that agreement, then that's absolutely fine, but parents aren't bound by that condition in the EHCP. So if situation changes or that it's not going to work for them to continue to provide transport or to fund it or whatever it is, you can always review the wording in section I in the EHCP generally through an annual review. And ultimately, if parents aren't happy with what is set out in there about what they have to do, in addition to the local authority's responsibilities, then you can challenge that through an appeal to the tribunal as a kind of last resort as well.
Thank you. Lydia, I don't think there's any specific questions.
One just popped up.
One just popped up.
As you said that.
Lovely. Let me just read that out. Hello, this is from Kate. Hello, my son is on his 8th EHCP annual review with Herts County Council. We've never had the draft review returned within the 4-week period, but now it is 12 weeks overdue. How can I enforce them to return a draft, as I feel they are delaying because they do not wish to consider our private assessments? I'm not sure what course of action to take next.
Right, okay. So with annual reviews, the first time goes, you've had the review. Within 4 weeks, the local authority has to say if they're going to either propose to cease the plan, to stop it, if they're going to maintain it as it is, or if they're going to propose any changes. So that's what they need to notify you within the 4 weeks. That isn't the same as them sending you this proposed draft, the proposed draft plan within that 4 weeks. This is where it can get a bit tricky, and this does happen quite a lot, unfortunately, where that it isn't particularly clear in terms of the law and guidance about how long the local authority should have between that 4-week period where they say they're going to make proposed changes and then actually doing so and sending it to parents. If it's 12 weeks, so if it's 12 weeks since the annual review, that is a long time. So really the options are to follow up with the LA in writing, to escalate it to their kind of superiors, so sort of their legal team if you need to, threaten them with a complaint, because if this is ultimately preventing you with the right of appeal if you needed it. It's also preventing you from actually seeing what proposed changes they're going to put in the plan, and therefore what needs to then happen in terms of provision for your son at school. And I think in terms of really it's following up in writing, getting legal advice if you're not sure, and if you want help with that about what to do and anything local authority should have done by this point. And the point about the private assessments, they should consider private assessments. They can't just say to you, we won't because they're not from our experts. If you put them forward and ask for them to consider them whilst preparing a draft amended plan, they should do. If they don't, you need to say, well, why not? What evidence are you relying on instead? And can I see that if I don't already have a copy of it? Ultimately, it's going to be a case of pushing them, and you do ultimately have a right of appeal once the final plan is issued. That may be some time away. I appreciate that. So it may be something to get advice on, just to see if pushing them might get a decision quicker. that's really kind of all you can sort of do, I'm afraid. It's not a very great setup for parents at this sort of stage of annual reviews. It kind of, you are sort of left, which is not how it should be. Oh, there's another one underneath. Oh, it's from Janet. So if it takes longer to find the right school, are there temporary measures for families? So ultimately, if you got to September and you either you haven't found a school, or local authority haven't named a school in the EHCP and you're going to go to an appeal, to go to your local authority and say, well, what alternative education are you going to put in place for my son or daughter that's suitable to meet their needs, that's going to be enable them to have a full-time education as much as possible that they can manage, factoring in any medical needs, that sort of thing. Go to the local authority. They have a duty under section, I believe it's section 19 of the Education Act, where if a child is not in school for kind of illness, exclusion or otherwise, the local authority has to find a suitable alternative and provide that. So again, it's going to be one of those situations where you do have to take it up with the local authority. That's in, you know, if parents otherwise do have alternative arrangements they can make, then you can do that. But ultimately, the duty is on the local authority to do so, and raise it as a matter of urgency if your child hasn't got a school place. I don't know, do you want to read out the next? There's a couple of other questions underneath. There's one from a Rita.
Yeah, we've got one from Rita. We have an EHCP for our daughter that has been updated each year with her school and social services. However, it is over 2 years that it has not been finalised or signed off. She is 16 and we are hoping that she'll be able to go to a residential college at 18. What can we do to get this completed?
So if there's a plan, this happens more often than I wish it did happen. I wish it didn't happen at all, where plans just aren't finalized, or they're kind of in this sort of limbo state and they just float along year after year and nothing ever happens with them. So if school and social services are happy with it, but if it's not been finalized by the local authority, I'm guessing, or signed off, well, they absolutely should. It should be. I don't know why they wouldn't have done that. It'd be writing to the local authority. It would be, I would say, even before that, getting legal advice if you're not sure about the status of the EHCP and if it is finalised or if it's not and what needs to happen. Probably next step would be writing to the local authority to say this is not finalised, it's been agreed for a number of years, but it's never been, whatever the situation is, not finalised after an annual review, whatever it is. Because you need that final signed EHCP. That's the one that's legally binding. That's the one that the school, college, next placement are going to be referring to and relying on. I would say it's worth getting advice, because sometimes we see plans where it's a bit ambiguous about what stage they're at, and sometimes they're kind of phrases like a proposed amended final and things, and they have all this wording on them when it's not particularly clear actually if it's a final plan and that's it, or it's gone through about half a dozen amendments and it's still not there yet. So I'd say have a look at it, get advice if you're not sure, but then I think ultimately following up with the LA if it should have been signed off by now. Or there's another one, there's a one underneath that as well, a little question.
Yep, this comes from Andy. At what stage is an EHCP finalised as far as an LEA is concerned?
So it's finalised as per the above one, really. Once it's signed by the local authority, the relevant officer, case officer, dated, it would have a cover letter with it as well, which the date should match the EHCP in theory, and that point is then when you've got a right of appeal as well in terms of that final plan if you don't agree with the content. Like I said, local authorities do sometimes have different versions of EHCPs. You can have drafts and amended drafts and first final and second final, and it can go back and forth so long. But what you need is that cover letter which just says, here's your final plan, giving you a right of appeal, signed, dated, says final, and it names a school placement as well and a type. That's another key point, is the school and or type of school needs to only be included when the plan is finalised. It shouldn't be in a draft plan or kind of a variation of a draft. It should just be once the plan is finalised. So that's quite a key indication if it's final or not. Yeah, have a look at that. If you're not sure, check with the LA and say, is this my final one? If it was but you didn't have a cover letter, get them to send the cover letter. Yeah, that's really what you can do to check, really.
Great, hopefully that answers that one. We have another question. We had a tribunal in February 2019 for an 8-year-old, which agreed the number of physio and OT hours and the qualification level of the physio. We have a review next week and they are proposing cutting, I don't know if that's supposed to be a half or 1 out of 2 OT and a third of physio input for year 11. He is still growing. His disability hasn't improved. Can they do this?
So local authorities can suggest that there are changes to provision, reduction in provision, but it's got to come from evidence. So if they have evidence to say that this almost young person now doesn't need this level of provision that they've had, well, you need to see what that is, and if you have any evidence of your own that says actually no, the amount that was agreed back in 2019 is still needed, you need to put that forward as well. The local authority could still, annoyingly, it kind of works in terms of it allows local authorities, they can still propose changes, even if it's not clear where the evidence has come from. They should absolutely rely on evidence. It doesn't always necessarily mean that they do. Sometimes they just say, oh no, they're doing fine, let's just save us some money, let's reduce it, they're fine, independence, all those kind of buzzwords, and off they go. But you ask for evidence. If you don't know what they're relying on to propose these reductions, ask for the reports, whatever it is, and ultimately, if they still go ahead and make requested changes at whatever stage the plan's at, so if it's an annual review, review next week. So if after the review they do propose changes, you can then respond and say you don't agree, if you've got evidence to say to the contrary, and then ultimately you can appeal the decision if they still reduce the provision and you don't agree that that's appropriate. You can then appeal it as well.
Thank you, Lydia.
Great, thank you.
Is there any more questions in there, Jackie?
Not at the moment, no. I'm just wondering if anybody else has anything that they would like to ask that we can maybe take off the recording, if that makes anybody feel more comfortable. Just on that appeal, Lydia, if they're appealing, does that mean that the provision might be cut while the appeal is going on and you just have to live with that at that time?
It's potentially, yes. It depends on what state the plan is in. If it's a case where you have an EHCP and you're happy with provision, and then you have a review, local authority says, oh, we're going to reduce the OT or the physio, then they issue a final amended plan that does have reduced provision, then yes, technically that is the plan that is then in force, and that's the one that will be happening whilst you appeal it. So I suppose it's one of those weird situations where often parents are so, they're obviously focused on just changing the plan. It's almost like, well, we can take with that now, even if they're it's not what we want, but we are challenging it and it could hopefully change. It's one of those situations where you end up putting all your energy on trying to get a successful appeal outcome, because that's all you can do. That is your one way of challenging it. And yeah, provided you've got good evidence to say that the provision is still needed, then if changes are made to the plan through the appeal process and you get another amended plan afterwards that then puts everything back, then the LA goes back to that one, has to enforce that one again.
Right. It looks like we've got another question just been added. Do the local authority have to make up therapies missed during the pandemic? It's a good question.
Yeah. So this is one where you would need to have a kind of proper chat to figure out what would need to happen, because there was changes in the law during part of last year during lockdown, which did relieve local authorities of their absolute duty to deliver therapy provisions in EHCPs under Section F. That's all gone now, so it's back to they have to deliver it. However, there were a lot of practical difficulties in delivering online alternative ways of therapies during lockdowns and kind of following. It really depends on what's in the EHCP, how much therapy was missed. Was this during a time when that duty was lessened and local authorities didn't have to provide this? They had to, I think it was reasonable endeavours. It was kind of these vague words in which is really hard to kind of pinpoint what that means. It depends on that. So potentially they would have to, but it really does depend on quite a few things about the timings of when the provision wasn't provided, what's in the plan. You know, was it provided alternatively, like online instead of in person when they weren't able to do that in person. So I would say if it's something you do want to follow up, then to get advice on that, because I think you need to do a bit of digging to see kind of what's what, and if it's worth following up as well. I suppose that's the other thing is, you know, even if they should have been providing therapies and they didn't do so, it's looking at, is it worth at this point in time, you know, a year on, 6 months on, 8 months on, to follow that up with them and say you didn't provide this for, you know, whenever last year for a couple of months. Potentially it is. It depends on what you want to do, really, what your aim is.
Yeah. Thank you. So I think that is everything in there, is it, Jackie?
Yeah, there was just a follow on there from that question about the pandemic, which was, it was part of my argument for not cutting it. And I think that is referring back, yes, to the physio and the OT being cut. So I
right.
guess that there was missed, I think if I'm reading that correctly, then I guess there was missed therapies during the pandemic. So cutting it at this stage is probably what the question is, really.
I see. Yes. Oh, I see. Yeah, again, it's looking at the evidence that you have for the here and now, because 2019 is 2.5 years ago, so most likely needs will have changed, not necessarily massively changed, but there's likely to be a difference, but you do need to have evidence to see exactly what is needed now. Yes, I see what you mean about in terms of being missed. Yeah, what you need to have a look into it, the specifics of it, I would say, to work out what didn't happen if they should have provided it at that time. Another question has just popped in, actually.
Yep, that's the LGO investigated my son's case and found in our favour that an EHCP was not in place for 3 years. I've asked them to put in place remedial support to plug this gap, but they have refused and told me to go to tribunal. Any views?
Okay, so if the local government ombudsman, which is the LGO, if they investigated and they found in your favour that the local authority didn't, so not in place, I'm presuming that means they weren't delivering provision properly for the last 3 years. So the LGO would have made recommendations about what should happen next as a result of that, and then that's then published, that decision, to say what the local authority has to do, what the LGO's findings were. Again, that's something which probably is worth getting advice on, because from the off, it would sound like the LGO decision should cover what would need to happen in terms of support for your son going forward. But I'm not quite sure why the local authority is saying you should go to tribunal. You could go to tribunal if you have a decision that you were able to appeal against. Local government ombudsman, you can't. That's not in that. You can't appeal that to the Send tribunal. Yeah, I think you would need probably to get advice on that, and yeah, and have a proper look at that. It sounds like they might need a bit of investigation to see what's going on, and yeah, what the local authority should be doing now for you ultimately if they're not doing what they should be.
Thank you.
Hmm.
Thanks very much, Lydia. I'm actually going to stop the recording now, because there might be one or two people who, you know, might want to just ask something sort of, you know, off the record. So just to sort of finish this part up, just say thank you everyone for joining. Special thanks to Lydia and to my colleagues Janet and Jackie. And if this recording will be up on the website, you know, in the next few days, if you want to have a wee look over it again. So thank you everybody, and have a good afternoon.